Hello friends, let's see the hip joint. When we see the anatomy of the hip joint, this hip joint is a multi-axial ball and socket variety of the synovial joint. Now let's see the bones which are going to form the hip joint. So when we see the bones forming the hip joint, the ball is going to be formed by the head of the femur. This head of the femur, it is nearly 3/4 of the spear, and it is most of the part is articular except at the fovea, and this foveal region provides attachment to the round ligament of the head of the femur. The head having articular cartilage over it, and this articular cartilage, it is thicker in the center part while it is thinner at the peripheral part. The socket of the ball and socket variety of this hip joint, it is going to be provided by this acetabulum of the hip bone. This acetabulum is a cup-shaped depression within the hip bone, which is going to be formed by the fusion of all the three parts of the hip bone. Those are ilium, ischium, as well as pubis. And these three parts, they are separated by each other with the triradiate cartilage. The margin of the acetabulum, it is complete all over except at the lower part, and this lower missing part of the acetabulum, it is called as the acetabular notch, which provides attachment to the two ligament. One is the transverse acetabular ligament and one is the base of the round ligament of the head of the femur. Within this acetabulum, there is a horseshoe articular area is there, and this horseshoe shape articular area, it is called as the lunate surface. This lunate surface is going to articulate with the 3/4 of the spear of the head of the femur. Within the depression of the horseshoe-shaped lunate surface, there is a fossa, and that fossa, it is called as the acetabular fossa. And within this acetabular fossa, we find the acetabular fat, and this acetabular fat is called as the Haversian fat. Now, this Haversian fat, it is in the form of the liquid in living individual. Now let's move on to the ligaments of the hip joint. There are as many as 7 ligaments of the hip joint are there. The first and most important ligament is this capsule of the hip joint. This capsule of the hip joint, it is a fibrous covering which is going to cover both the surfaces of the hip joint, and this provides the protection to the joint. This capsule of the hip joint on the anterior side, it is going to attach somewhere here at the intertrochanteric line. So whole of the neck of the femur, it is intracapsular, while on the posterior side it is going to attach around 0.5 centimeter medial to the intertrochanteric crest. So on the posterior side it may somewhere attach here. So the medial part of the neck of the femur on the posterior side, it is intracapsular. On the medial aspect, this capsule, it is going to attach with this acetabular margin, while in the lower part this capsule, it is attached and blend with this transverse acetabular ligament. So when we see the capsular attachment, this capsule is going to close this hip joint from both the sides. Now this capsule, it is covered with the synovial membrane to the inner side. So when we see the synovial membrane here in this figure, this one is the coronal section of the hip joint, and in this figure we can appreciate this is the capsule of the hip joint, and here this one is the margin of the acetabulum. This margin of the acetabulum provides attachment to this fibrocartilaginous rim, and this is called as the labrum of the joint. This labrum is helpful to deepen the acetabular fossa, and that's why it provides the stability to the hip joint. Now here in this figure we can appreciate this ligament, it is attached to the fovea of the head of the femur, and that is called as the round ligament of the head of the femur. And at the lower part of the acetabular margin, this thickened band of ligament, it is the transverse acetabular ligament. In this figure, within this acetabular fossa, this yellowish color structure is the Haversian fat. And both the articular surfaces of the hip joint, they are covered with the articular cartilages. So here in this figure, this bluish structure are the articular cartilages. Now after having this much orientation, let's trace the synovial membrane of the hip joint. When we trace the synovial membrane of the hip joint, it is going to cover the inner aspect of the capsule, and it reaches up to the peripheral part of the articular cartilage. Now, as we trace on the superior side, this synovial membrane, it is going to cover the both the side of the acetabular labrum, and then it is going to reach up to the margin of the articular cartilage of the acetabulum. Now, on the head of the femur, this synovial membrane, it is not attached with the articular surface, but at the fovea, this synovial membrane, it is going to cover the round ligament of the head of the femur from both the sides. And then it is going to divide into two layers. The inferior layer, it is going to continue with this inner aspect of the capsule, while the superior layer, it is going to cover the Haversian fat. So the Haversian fat, it is intracapsular, but it is extrasynovial. While this round ligament of the head of the femur, it is also intracapsular but extrasynovial. So this is all about the synovial membrane of the hip joint. Now let's move on to the other ligaments of the hip joint. So for that, in the previous figure, we can notice that this margin of the acetabulum, they are covered with one ligament, and that fibrous ligament, it is called as the labrum. So this labrum in this figure, it is attached with the margin of the acetabulum. This labrum is responsible for the deepening the socket of the acetabulum, and that's why it provides the stability to the hip joint. This labrum, it is a fibrocartilaginous rim. Now, when we see the lower margin of the acetabulum, it is missing, and that is called as the acetabular notch. And within this acetabular notch, one ligament is attached, and that ligament is the transverse acetabular ligament because it is situated transversely and attached over the both the edges of the acetabulum. This transverse acetabular ligament represents the labrum without cartilaginous cells. Now after that, let's see one more ligament which is situated inside the joint cavity, and that ligament here in this figure, it is the greenish in color, and this ligament is the round ligament of the head of the femur. The other name of this round ligament of the head of the femur is the ligamentum teres femoris. This round ligament of the head of the femur, or ligamentum teres femoris, it is a triangular shaped ligament with the apex attached over this fovea of the femur, while the base is attached over this transverse acetabular ligament and the margins of the acetabular notch. So this ligament is situated within the capsule, but it is covered with the synovial membrane on each side. That's why it is extrasynovial also. Actually, the function of the ligament is to provide the strengthening to the joint, but this round ligament of the femur, it is not providing the strength to the joint, but it is merely important for providing the blood supply to the head of the femur. And this ligament get taut during adduction of the hip joint. So here in this figure, we have seen this capsular ligament covered with the synovial membrane. The second ligament is the labrum of the acetabulum. Third one is the transverse acetabular ligament. Fourth one is the round ligament of the head of the femur. Now let's see three external ligaments which are situated outside the capsule. So here in this figure, one ligament is attached from this anterior inferior iliac spine, and this ligament it passes downward in two bands. The vertical band it is superficial, and the lateral band it is deep, which is going to attach with this trochanteric line of the femur. The name of this ligament it is from the ilium to the femur, and that's why the name of this ligament is the ilio-femoral ligament. The other name of this ilio-femoral ligament is the ligament of the bigelow. This ilio-femoral ligament or the ligament of the bigelow is the strongest ligament of the body, and which prevents the hyperextension of the hip joint. As the center of the gravity it passes behind the hip joint in case of the anatomical position, the natural tendency of the hip joint is for the hyperextension. And this hyperextension is prevented by this ligament of the bigelow or the ilio-femoral ligament. So this is very much important in case of the hip joint. When we see the intermediate stratum of this ilio-femoral ligament between the deep and the superficial part, or we can say vertical and horizontal part, there is an intermediate stratum which is situated somewhere here, and it is pierced by the ascending branch of the lateral circumflex femoral artery. Now one more ligament is present in this view, and that is this ligament. And this ligament it is going to attach from the iliopubic eminence near the acetabular margin, and this ligament it passes downward and medially and passes deep to the vertical band of this iliofemoral ligament and blend with the capsule of the hip joint. And this ligament is the pubofemoral ligament, as it is going to attach over the pubis as well as the femur. Now one space is created between the pubofemoral ligament and the vertical band of this iliofemoral ligament, and through this gap the synovial pouch of the hip joint it going to comes out, and it lies between the tendon of the psoas major and the hip joint, and that's why it is called as the bursa for the psoas major. And this bursa it is a communicating bursa with the hip joint. So we have seen this two more ligaments. So the fifth one is the ilio-femoral ligament, and the sixth one is this pubofemoral ligament. Now let's see one more ligament on the posterior side, and that ligament is the ischeofemoral ligament. So here in this figure, this is the ischeofemoral ligament. This ischeofemoral ligament it is attached to the margin of the acetabulum, and it passes upward and laterally, and the fibers are spiraled in manner and going to fuse with the capsule of the hip joint. So this ligament it is the ischeofemoral ligament, which is the seventh ligament of the hip joint. So there are seven ligaments of the hip joint are there, which we have discussed.